Hey everybody, it's Dr. Lisa L. Campbell, the Growth Motivator. I'm back with another weekly book review. Today I am reviewing Socially Determined, the Healthcare Executive's Role in Health Equity. So, this is a book that I actually learned about at the American College of Healthcare Executives Conference last year, or some webinar, but it was through the American College of Healthcare Executives, which is an organization that I am a member of. And the book is by Shawn Rossi, Karin VanZant, and Kina L. White. This is not a feel good book about equity. It's a leadership book. It's written for healthcare executives who are ready to move beyond the statements, the committees, the compliance checklists, and are ready to move into accountability, strategy, and measurable impact. The authors make it very clear from the start. Health outcomes are socially determined, and leadership decisions either reduce inequities or reinforce them. Neutral leadership, in the middle, is not neutral at all. Socially determined challenges leaders to rethink their role in advancing health equity. The book connects social determinants of health directly to organizational strategy, quality outcomes, financial performance, and trust with the communities we serve. The authors ground this work in the 5 areas of social determinants of health. Economic stability reflects whether or not individuals' basic needs are met. Basic needs: food, housing, employment, education, access, and quality shape health literacy, opportunity, and long term outcomes. Healthcare access and quality determine whether people can obtain timely, culturally competent, and effective care. Neighborhood and built in environment influence safety, transportation, housing quality, and access to healthy food. Social and community context includes support, trust, discrimination, and connection to the community, all of which directly impact physical and mental health. Rather than positioning equity as an add on, something that's nice to do, the authors frame these 5 areas as leadership responsibility, belonging in boardrooms, strategic plans, dashboards, and executive decision making. So, as usual, I want to give you my 5 growth moments. And so, growth moment number one, as a healthcare professional for the last 34 years, healthcare is definitely my passion. So, number one, health equity is a leadership responsibility, not a department. Ooh, let me say that again for the folks in the back. Health equity is a leadership responsibility, not a department. One of the strongest messages in this book is that health equity cannot live in a silo. When equity is assigned to one office or one role, it becomes optional. These authors challenge executives to own the outcomes the same way we own quality and safety and financial performance. This reframes equity as a leadership mindset and not a program. Growth moment number 2. Data without action is performative. Data without action is performative. This book emphasizes collecting and stratifying data, but it goes further. Leaders are challenged to answer, to ask the hard questions like what happens after disparities are identified? Woo, we identified them. But what happens if the data reveals inequity and nothing changes? Leadership has failed its responsibility. That was a powerful reminder that transparency without accountability does nothing. It does not drive transformation. Number 3. Ooh, this is my favorite. They're all my favorite, but this is my jam. Compliance is the floor, not the ceiling. Regulatory expectations from accrediting bodies, CMS, and payers are addressed throughout the book. But the authors make it clear meeting requirements does not mean equal equity work, meaningful equity work. Executives are encouraged to stop asking, what do we have to do? And start asking, what should we be doing to change the outcomes? I got to say that again. Stop asking, what do we have to do? And start asking, what should we be doing to change outcomes? Number 4, community partnerships are strategic, not charitable. Community partnerships are strategic, not charitable. A key insight in this book is how community investment should be viewed through a strategic lens. Partnerships with community organizations are not acts of goodwill. They are essential to improving outcomes, reducing utilization, and building trust. This challenges leaders to rethink how we define ROI or return on investment. Number 5, this is the one that's a little scary for some folks. Leadership courage is required. Leadership courage is required. Perhaps the most important growth moment is the call for courage. Health equity work requires leaders to examine their own assumptions, organizational culture. My doctoral dissertation was about organizational culture. And then the third area here is power structures. This book makes it clear equity work will create discomfort. Equity work will create discomfort. Avoiding that discomfort preserves the status quo. So, who is this book for? This book is ideal for healthcare executives, senior leaders, health system administrators, and strategists, board members, governance leaders, and graduate students, because you're the future, in healthcare administration and policy. The book does assume, that readers understand healthcare systems and are positioned to influence change. Socially determined is a leadership mirror. It asks executives to look honestly at how decisions priorities, and structures shape health outcomes long before patients ever enter the exam room. This book does not offer quick fixes, but it does offer some clarity. And with clarity comes responsibility. If you are a healthcare leader who believes equity matters, this book challenges you to prove it. Until next time, I'm Dr. Lisa L. Campbell, the Growth Motivator. Until next time, keep growing. I'll see you next week.